You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how to look years younger without surgery. According to my first guest, she was Beverly Hills' go-to registered nurse to look years younger with Botox and lasers and IPL and Ultherapy treatments. Now she's here in San Diego, and she's at the hot spa right now. With us, we have Teri Ellis. Teri, welcome to the program.
Thank you. Thank you for having me.
All right, great. So you believe that you can look years younger without surgery?
Absolutely, no question. Right now, the treatments are minimally invasive with no downtime. That's the idea that we're shooting for. A lot of people are staying away from surgery. Even in nursing, we always say, you know, when someone's ill, you always want to take all the paths before you get to that surgical point. And that's the same idea as what we're doing here in the cosmetic industry. So we do these minimally invasive procedures, things as small as we start with acne injections. Let's say if you have a big red carpet event, or you have a reunion, something like that, and of course the stress gets you to pop up one of those nice ones, you know, right in the middle of your nose or right on your cheek here. So we do acne injections just for that.
And get rid of it right there?
It'll get rid of it. The next morning you wake up, things are looking good, and you're off to your event. So that's our least invasive. Then we do all the injectables. We do the fillers, the Botox, all the things that just kind of fluff up and give you that juicier skin that you used to have. We do lasers as well. So lasers with no downtime that do lifting and tightening of the skin. So there's a lot of exciting things going on right now with no downtime, minimally invasive, that can turn the clock back for you at least that 10 years.
And Botox, you do a lot of Botox?
I do a lot of Botox, and I am the gold standard. I love Botox. I think it's a wonderful product. It's been around safely for decades, used in large amounts. What we use in the cosmetic industry is we use very small amounts. We know that it's very safe. Otherwise, I always say half of La Jolla would be dead today. So very safe. It's been around for a long time, and it does make a huge difference, all of these procedures.
Now, the reason why we invited you on the program today, and people need to know it's a real interview. I'm not endorsing you or on your side here. I've talked to people that know you, that work with you. In fact, the owner of the spa said, I said, why does she get better results in your opinion? I asked the owner of your spa, and she said, because she takes more time. She's meticulous with the patient.
That is
knows
true.
how to push the machines, things like that. But we invited you to talk about this Ultherapy, which, I have a lot of plastic surgeons that come on this show. And everybody seems to agree, Ultherapy works. What is it?
It is. Right now, Ultherapy is the hot ticket item. Everybody's talking about it. We've heard about it being featured on The View, on Good Morning America. Rachel Ray's talked about it, the doctors. So it's a real hot ticket right now. Ultherapy is a minimally invasive procedure with no downtime that gets you to grow your own collagen from the inside out using ultrasound-focused energy.
So it's like you hold a handle, put it on the skin.
Right. And it bypasses that top layer of skin, so there's no downtime. You don't have anything outwardly to recover from, but yet you're growing your own collagen from the inside out.
So
really
it heats
exciting.
like the underlying tissue.
Right. So we take this in 2 layers. We do 2 layers with the ultrasound energy. And the first layer we bring down to the muscle layer of the skin. So if your plastic surgeon were to do a facelift on you and dissect away all these layers, he gets down to that muscle layer, and that's right where the Ultherapy is working. So the first pass we do at that deep layer. The second pass we do after that is up to the skin layer to tighten up the skin as well. So it's tightening up the muscle layer and the skin layer as well to give you that nice tightening and lifting effect.
So it's working like with gravity? I mean, things like, for example, a little bit of a loose neck.
Exactly.
In 40s, that's the first.
Right.
It picks it up?
It lifts it up. It is
Really?
FDA approved. Gone through its trial.
Temporarily, like an inflammation?
No, it's a permanent change. You know, we can help the here and now. We can't stop that aging process, but we can stop the here and now of what's going on. So 2 ways to age nowadays. One is to age gracefully, and who wants to do that? So the other way is to fight it and go ahead and have your treatments done
like
in
use
order.
technology.
Use the technology.
To look your best.
Absolutely. Everybody wants to look their best.
Now, going into this, and I told you I'm very skeptical, because I could spot people that have had fillers.
Right. Well, you spot the bad ones is what you spot. It's
Because
just
you've had it done, you say.
correct.
I know your age. You look at least legitimately 10 years younger.
Thank you.
Have you had a You haven't
We've
had fillers,
played with
have you?
all of this stuff. We've
You've had
got
a little bit of
fillers and
fillers?
Botox. Right now we've got fillers, Botox, we've had Ultherapy, we've done it all. But there's a way to make it look natural. You know, people always are a little hesitant in the beginning and always feel like, oh, you know, I've seen a lot of people have some bad work. Well, that's right. You see the bad ones, but you don't see the good ones. That's the idea of what we do here. It should be able to look natural and look like you, but just a little juicier, a little more refreshed, a little sexier. And that's how it should be.
When you say juicy, juicier. Just what does that mean
Just
to you?
more supple skin. You have that thickness, that apple of the cheek again that used to be there. For when we have a laxity in the skin and the skin starts to drop, and we get to lift that again with a thicker skin base.
One of the most amazing things about our spa is the transformations we see with our customers every single day. Whether it's as simple as a facial and corrective skincare or the amazing med spa services that we offer. It's such a pleasure to actually see a client, patient, or guest that just looks in the mirror, and the smile that they see when they look at themselves for the first time is so rewarding.
I recently had Ultherapy done, and I waited about 60 days, and I saw my sister, and she looked at me and said, "What have you done? Did you get Botox? Have you had some filler?" And I finally had to say no. I had Ultherapy, and she ran right out. And now she is in the process of Ultherapy, and the results on her are as amazing. But when I look at myself, it's a pleasure to put makeup on in the morning. And when I went to a reunion back in December, there was a group of folks that I knew from high school, and they were amazed. "You look amazing, you look great." And I wanted to blurt out, "It's Ultherapy."
I love Ulther. The reason I love it is I was feeling like my face was dropping, if you will, and it was just so unattractive to me, and I did not want to start with an invasive treatment, if you will. So I found this treatment, and I couldn't be more thrilled with the results. Instantly, I saw a difference, that my skin was lifting. My neck is tighter. My actual jowls have been lifted. I noticed a huge improvement with my forehead. The eye area through here has been lifted. I couldn't be more happy with the results.
You say you attract women that want this natural look.
Right.
That don't want, I mean, they actually tell you, I don't want.
Sure. They've watched
That
those
duck
housewife shows and whatnots where these ladies are walking around with almost a status symbol of getting their face done, of having these huge duck lips and having these huge cheekbones. But for the rest of us, that doesn't really suit our environment. So for Beverly Hills, I think that works just fine. But in San Diego, my sense of aesthetic matches so much better because I like that natural look. We like that classic beauty. We like to be able to look like us, but just a little ramped up, a little juicier, a little sexier, just having that thicker skin and that the pore size being smaller and getting rid of red spots and brown spots and all of that makes us look aged and makes us look tired. So we want to be able to fix those things but have a natural look as well. So we don't want to send people out in the world with those duck lips and whatnot. And then people are always scared. They come to me and they say, "Hey, I've never done this before. I've always thought about getting my lips done." But then they look around and they see those big, huge lips, and that's what they're scared of. So when they come to us, I assure them, you will not walk out looking like that. I will strive to make us look more natural, look like you, but just turn the clock back about 10 years and then keep you there. So even with you, Randy, if you were to come in, we are able to turn back the clock by using our minimally invasive techniques.
What could you do for me, for example?
You know,
and do men come in?
Men are coming in, absolutely.
Okay.
And more men are coming in than ever before. Absolutely.
All right.
And they're all taking advantage of this. You know, especially men don't want that downtime. They've got that active lifestyle. They're out doing things. They want to look better without having that downtime. And that's what we're able to provide. So what we can do for you, Randy, is once you come in to see me, we can take the clock and turn that back easily 5 years.
Okay, so you would give me 5 years.
Absolutely.
younger. Okay.
5 years right off the top. And then 5 years from now, we're going to look at you again and say, "You know what, Randy? You look better than you did 10 years ago."
You're convinced
And we're
of that?
going to keep you there. Absolutely. All the procedures we have nowadays, we're staving off that aging process.
As long as what? I mean, I have to follow your protocols.
You have to follow the
Come in like every
protocols, of
6
course you
months or
do.
something?
Absolutely. It's just like training at the gym. You can't go once and expect to be in shape. It's the
So
same
a woman
thing.
that goes to you 37, 38, 40, we've had this discussion.
Yes.
You believe you can keep her looking that way for maybe even the next 15, 20 years.
Absolutely, and we've done it. It's not just hearsay. This is happening. So I have one woman, for example, who I had seen since she was about in her early 50s. At that time, she was a young grandma, and she was starting to feel a little tired, and she would look in the mirror and start seeing the little bit of sagging, a little bit of jowling, a little bit of this under eye stuff going on, and just started seeing those early signs of aging. So when she came to me, we were able to do some minimally invasive techniques to where we turned back that clock about 10 years. And her friends were asking her, "Well, what did you do? Was it your hair? Is it they kept looking at her, but they couldn't quite put their finger on it. So now, 20 years later, here we are, and she's still looking like she did then.
Interesting.
Not fake looking, not anything like that. She looks like her, but just revved up, just juicier skin, that thicker skin, the minimal pore size, all of that. And now her friends are asking her, what have you been doing? You look the same as you did 20 years ago, while the rest of us are now looking like old grandmothers. So now their friends are coming in to see me as well, and we're able to turn that clock back for them too.
Now, for people that don't know your spa, you're in Carlsbad.
Right.
And what are the different services you offer?
Well, besides our med spa department, we also have a wonderful aesthetics department. We have world-class estheticians who have beautiful glowing skin, and they give the same to their clientele. So they do facials and peels. They also do skin regimens,
Peels work,
home
by the
skin
way?
regimens. Absolutely.
How many times a year do you think somebody should get a peel?
Well, everybody can benefit from a peel down here in San Diego. With all of this beautiful sun around us and all
Okay.
of these beautiful beaches, we can all stand a little bit of a peel. So we can do peels once a month. We can do them once every 6 months if that's what the patient would like. But in order to keep that beautiful, supple skin, we do want to be able to do those maybe once a month.
Okay.
And just upkeep for that. And that'll give you that just glowing, beautiful, vibrant, healthy skin that everybody just adores.
So next level up in your spa. What else?
So we also do massage, we also do nails, but the massage is good also for giving us that holistic good feeling, the feely goods, when they do the massages, as well as taking care of their face and taking care of their bodies and doing their nails. Everybody feels just better, and who doesn't want to be their better self, you know?
All right.
So it takes everything, it takes an army to keep us all going,
Okay.
But the combination of all these therapies with the med spa is really working well together. I've worked in other doctors' offices and plastic surgery offices and whatnots, but we never had the advantage of having this holistic treatment. So working together, all of us as a team, is going to give you the best result. So you're going to feel good and radiate from the inside out. And who doesn't want that?
Now, moving on for the sake of time, to Ulthera. That's why we invited you on the show. And for people just tuning in, we're talking about looking years younger without surgery, according to my guest. And Ulthera is, just so I understand, so it's like ultrasound, or is it?
It is. It's focused ultrasound energy.
So it heats the underlying
It
tissue and
does.
kind of shrink wraps the
Correct.
face?
You've got that
Is
exactly
it like
right.
thermage, what thermage was?
Well, it's a little
Or
bit different. Thermage and fractionated lasers and all of that sit up at the surface of the skin and help with that resurfacing, the brown spots and the red spots and all of that. But it doesn't do the tightening and the lifting. So the skin quality is beautiful, so we love those lasers, but it doesn't do that lifting and tightening that we want to see.
Okay. So what areas? Let's start with the face.
Sure.
With this Ulthera. Am I saying it right?
Correct. We can treat anywhere from hairline down to the décolleté, down to this chest area. So we're able to treat, and we can treat in sections, we're able to do the whole area, or we can break it down into little areas. So the first FDA approval we received for the Ultherapy was the brow area. So folks that have that really heavy lid where the eyelids are just sitting on their eyelashes like that, and that have trouble with their peripheral vision, that would be an ideal candidate for that in the brow area. I had a patient who had come in, and she was actually only in her 30s. It wasn't from skin laxity, but a lot of clients are coming in also because of genetic issues that they've inherited from mom and dad, having those heavy eyelids. So we see a lot of that. So even younger clients are coming in for that.
So loose skin above the eyelids.
Loose skin above the eyelids.
This Ulthera, you hit that area, what does it do? I don't get how it's working.
Sure. Wherever you provide those zaps is going to be the vector for our pull. So with that said, what I mean is, if let's say a patient comes in with these heavy brows here, real low brows and the heavy lids right here, we zap this area right here above the brow, and that's going to lift this area. So it will, in turn, it's going to lift the actual brow itself, which before could only be done surgically, but now we can do it through Ultherapy. So it does lift the brow itself, and in turn will also give you more crease of your eye showing. It's really neat treatment. So when I did that patient in her 30s and we were able to do that, she came back in 3 months, just couldn't believe it. Everybody's been asking her, what have you done? Is it your hair? Is it your makeup? But they couldn't figure it out. But if you look at the before and after pictures, drastic difference.
So it has a tightening effect.
It has a tightening effect. And it does take a little while for that collagen to remold itself.
Now I heard, and because I'm thinking about going in.
Right.
You've convinced me.
Correct.
But it seems painful, like very painful, because that's what everybody says.
Everybody says, but it doesn't have to be that way. We provide you with some medications, some prescribed medications from the doctor that allow you to relax and get through this procedure without feeling much pain at all.
You called it a cocktail of medications.
A cocktail of medications that we can give our patients ahead of time. So they must have a driver that day as well. We can't have them driving around loopy. But the medications do take that edge off to where the patient is just comfortable on the bed. So I've had one patient that's already had 2 treatments. She had them 1 year apart. She's kind of doing it as a birthday thing every year. And the first time we did it, she did it with just Motrin on board, 800 milligrams of Motrin. And we all know that's just Advil. So taking a few tablets of Advil, she was okay, got through it, but was uncomfortable. It was a little spicy for her. So the second time she came in, we had this protocol in place where she did receive her prescribed medications, and she was basically snoring through the procedure.
Okay.
So we know that we're very successful with getting patients comfortable and able to get through this procedure without having that pain issue.
Once I had Ultherapy, I saw a tightening. I started feeling much better, much brighter, younger. I noticed my eyebrow lift. It just made me feel so much better about myself. Being 55 years old, it's something that, you know, you're starting to come into age. You want to grow with age gracefully. I did not want any cutting. I didn't want anything that I couldn't go to work the next day. I could go to work. I looked great. My boyfriend didn't know that I had done anything. I just started looking better and not quite as tired.
When people ask how old I am and I tell them my actual age, they are shocked. I'm a grandmother of 4 grandchildren, and I find it amazing that people still ask me actually how old I am.
I could see it lift, and now I have my neck, if you'll notice, it's nice and taut. The jawline is much more defined. And I've noticed that my forehead, I've got a natural lift in my forehead, and my eyes, which just open up my eyes.
We focus on results, whether it's facials or whether it's getting that lifting and tightening treatment. And one thing that is totally a game changer for results is Ultherapy. So if you're looking to do something that is firming and tightening and you're not quite ready for plastic surgery or undergoing the knife, then we would love to talk to you about what Ultherapy can do for you.
So one of the places we love to treat is the mid-face. As we age, we start to lose this juicy fat pad that we had in this apple of our cheek, and it starts
So
to...
under the eyes.
Under the eyes, yeah. We treat all around the eyes, but also right here in the mid-face area, we can treat the crow's feet, under the eyes, and the cheekbone. And that just gives us this fabulous result of lifting in the middle here, giving us that juiciness back to that apple of the cheek, which in turn
Without
is
fillers.
without fillers. And that gives us a
right?
more youthful appearance. When we're younger, we have these beautiful faces that are shaped like upside down triangles, basically, where all the juiciness and thickness of the face is just beautiful. So we're like an upside down triangle, let's say. But then as we age and we start losing the collagen and elastin, we start getting skin laxity, we actually turn into a triangle where most of the thickness comes down to the bottom of our faces. So when we're doing these lifting and tightening treatments, it gives us back that lift that we had when we were
Would
younger.
an expert, if I showed this to some of my plastic surgery buddies or academic buddies, which I have, would they deny that? Would they say this is an exaggeration?
They would absolutely not. And a lot of your plastic surgery buddies are also using Ultherapy
They are
in
telling me
their
they're using it.
practices.
In fact,
Yes.
almost all of them
Correct.
are using it.
So what their
But
school...
we don't talk at this level like we're talking here. So you're saying in this area, for the bag area, it
will tighten and lift.
and fill, because you're saying that the heat makes your body produce more collagen.
Produces more collagen.
So wrinkles could
Absolutely.
be filled in?
They absolutely
because of
can.
the more collagen?
You've got that right. So what this is doing, this is heating up those deep tissue layers, and in turn our body says, hey, we need to go in and fix that, and we send in our little soldiers, and those soldiers are called collagen. So those little collagen soldiers come in, fluff up the area again, and take care of our inflammation and all of that that's going on underneath from this treatment, and those collagen will grow and spread, and it's going to make a more even skin, taking care of those wrinkles.
So when you watch, like celebrities on TV that look great for their age in their 50s or 60s and don't look surgerized, are you convinced they're all doing this Ulthera?
A lot of them are, without question. And so for me, having my past being a nurse in Beverly Hills, I do know quite a few people there, and we do hear things. They do use Ultherapy.
So this is the hottest thing. I mean, this is like the new hot thing?
Absolutely.
Is it called by another name, or is it always
It's
Ultherapy?
Ultherapy. Either one. It's Ultherapy, ultrasound treatment.
So would you say, I don't want to put words in your mouth here, because this is exciting, actually.
It's very exciting.
When we're done taping, I've got to make an appointment.
Let's
go. So a little bit of Botox, if you need maybe a little bit of fillers, maybe some fractionated lasers, IPL, whatever, but Ulthera should be part of this regimen.
It is.
Of looking your best.
Absolutely, because all of the other therapies sit on the top of the skin and work with just the surface, whereas the Ultherapy is working down at that muscle layer and on the skin. So it's doing twofold. It's doing things that all of those other lasers combined can't do. We love the lasers, we love that clean look that they give, but they don't give that lift and that tightening that the Ultherapy can do.
And you believe that it's transforming people's lives.
Absolutely.
Why?
Absolutely. Well, you know, people start feeling, they look in that mirror and they start feeling those early signs of aging. They start to lose that confidence. They start to lose that skip in their step. And, you know, when they start passing by mirrors, they're not looking as much as they used to. For example, I've got a patient who's in her mid-40s, just going through a recent divorce and had raised her kids, and she's an empty nester now, looking around the house, and the house is empty, no one that she has to take care of. So then she takes a look in the mirror and says, hey, where have I gone? You know, they look in the mirror and start seeing those signs of aging, the droopiness and the jowling and all of that. And they start to feel a little insecure about themselves. So this gal who is a patient of mine, she was an empty nester, just recently divorced, and she had come in to see me, shoulders slumped a little bit. And she said, hey, you know, I want to start doing better for myself. I want to take care of myself and put myself out in the world. And I don't feel like I can do that. But what I'm going to do is, instead of losing that 10 to 15 pounds first, I'm going to come see you and get some procedures to just brighten me up a little bit.
So what happened?
And so what we've seen is we see those patients coming into the spa. That's the other advantage I have from being in the spa is I can see these patients.
Like
not
the progression.
Just, right. Not just, you know, initial visit and then you see them again when they're on empty. I get to see them through their whole transformation. I get to see them coming in for massages or their nails or whatnot.
So they even act differently, you said, when they walk in?
They act differently.
Like their mojo's back or something.
Absolutely. Yeah, they get their groove back. So they come in to see me and all of a sudden their shoulders are back. This one patient in particular just it always sticks in my head. She just had such a glow about her. And I started seeing her come in and progressively she'd start dressing a little bit nicer. She did lose that 10 to 15 pounds. She was carrying herself a lot higher. She would come in with that new cute purse and didn't feel embarrassed to do herself up a little bit more than she used to when she used to shy away from being in public. So you do see these transformations. And by the way, she did put herself on one of these dating websites and her picture was so phenomenal. Her friends were actually asking her if that was a touched up photograph. And it wasn't, I assure you.
So after Ulthera, I was in the green room, you were saying, Randy, they're doing selfies, they're on Facebook, they're no longer blurring their face on Facebook.
It's true. And I become friends with a lot of my patients. And what we have seen is you start seeing more selfies. You start seeing that person more involved in the photographs. Instead of taking pictures of the kids, they want to be in the pictures with the kids and putting that on Facebook and putting that out to the world. You know, it's an amazing transformation.
You can go a lot of different places for Botox and fillers, but what we specialize in, it's really that blend. It's taking great skincare and facials and peels and the spa lifestyle, and then layering in what you can also do with the med spa services, the fillers and Botox and Ultherapy and body correction. And so we look at it of really getting those results from start to finish, from facial to almost the facelift in our med spa.
I actually, this is quite a funny story, just found a new boyfriend and he is 15 years younger than me. So I find that shocking that I would have fun with a younger man and he had no idea how old I actually was.
I encourage every woman who still wants to be active in the workforce, who has a healthy and active lifestyle, regardless of their age, I would recommend Ultherapy. It's going to give you all the confidence that you need as we age, and it is the best thing that's ever happened.
I'm optimistic about the future and so happy that I found this treatment. Ultherapy basically can keep me looking much younger without the invasive effects. This makes my heart sing.
With my new face and the Ultherapy, I'm able to go out with confidence, and I find that I have a kick in my step. I smile all the time. I am happy to get out and meet those, and I love it when they ask me how old I am, and I get to say, Ultherapy.
Now we are almost out of time. What else is Ultherapy?
We have to talk about lower face Ultherapy, just the most amazing treatment. We are able to treat the jawline and the neck area, and décolleté
Like
as well.
it sucks up the neck?
Well, it does lift, yes. So what I was saying earlier is wherever we provide those little zaps will be the vector for our pull. Again, so what that means to us is if we zap this jawline area where we've got that loose jowly skin, it does twofold for us. One is as it tightens the jaw, it will help bring this area down, which in turn also helps way up at the eye level. But also down here, when it tightens from the underside, it's going to lift that neck area and it's going to help with these marionette lines that we all hate so much. As we age,
So
we
the
lose
corners of
that.
the mouth.
The corners of the
you
mouth,
zap
correct.
that area.
We zap down into the jaw area, we zap to the cheek area, so it gives a nice taut look to that area as well.
Because your neck, I mean, is fantastic.
Well, thank you.
And I know your age.
I have had the Ultherapy, and I can tell you my neck is now 10 years younger. So it's definitely given me that clean angle back that I used to have. So when you're younger, in your 20s or so, you have that nice clean angle. And as we age, we start to get this little waddle down here, and the Ultherapy is wonderful for that. But it's not only for aging, it's also for younger folks who genetically have that thicker neck area, and it also helps to tighten that area as well.
Now, can somebody be too far gone for the neck and jowls?
Well, we do refer patients out to plastic surgeons if they have too much skin laxity going on there.
Okay.
Yeah, absolutely. We know our limitations, but for the most part, anybody that has that loose, jowly laxity of the skin down here, we can help them. It's not only people from the aging process, but it's also people, let's say, who are very thin, athletic. I do see a lot of yoga instructors that are very thin, don't have a whole lot of fat on them, so they start losing those fat pads in their face.
And this will rebuild it a little bit.
And it will rebuild it, not just a little bit. It will rebuild it significantly.
Now, and we are completely out of time.
Okay.
But you call décolleté, that's women wear V shirts or
Correct.
whatever.
Right.
Why there?
Well, a
'Cause it's
lot
not
of us
sagging.
are side sleepers. You know, we sleep on our side and we get those wrinkles in there when you wake up.
Interesting.
Yeah,
That's what
so
it
we
is.
do get that wrinkly sort of area there. And this is the first and only FDA treatment that is licensed to lift and pull on this area to make it smoother.
So wrinkly chests,
Yes.
this helps.
Right. And they can go to their plastic surgeons and have their facelifts and neck lift and all of that. But if you have this chest down here with a lot of wrinkles on it, that's going to give away your age.
Ulthera.
Ulthera.
That's your message today.
It
Well,
is.
look, we're out of time. I want to thank you so much for coming on
Thank
the
you
show.
so much for having me.
It was a pleasure. We'll have to have you back talking about something else.
Thank you.
Thanks again. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.